We are here today as nonprofit organizations, government agencies, corporations, and caregivers coming together to build a network that will provide respite to all ages throughout our state in Louisiana.
We're creating the first steps for trying to create a system of support for caregivers who are caring for their loved ones at home, so as we can give them options for keeping their loved ones in the comfort of their own home.
Louisiana was looking to expand their respite coalition, and so the idea today was to bring together a lot of different organizations within the state who provide respite care or could potentially provide respite care, so that everybody can work together. Basically, this is a working meeting for people to explore what is available in the state in terms of respite care and what is not available, and bringing all those different organizations together offers a wonderful opportunity to share the resources that are available and look at where the deficits are. I am delighted to be here this morning to talk with all of you about the National Lifespan Respite Program. And that's going to be impossible. I'm going to be leaning into this. That's better? Yeah. Okay. I'm a little nervous, so please bear with me. I said, as I was introduced before, I represent the Arch National Respite Network and Resource Center. We are funded through ACL-AOA to provide training and technical assistance to the Lifespan Respite grantees. The majority of family caregivers are caring for someone under the age of 75, with 28% caring for someone between the ages of 50 and 75, and 28% caring for someone under the age of 50. A growing concern now is the aging population. There are approximately 10,000 individuals turning 65 every day. But the fact is, the majority of family caregivers are caring for someone under the age of 75. Now in Louisiana, these are figures from 2009, there were approximately 917,000 family caregivers in Louisiana who provided 600 million hours of care. The value of that caregiving is estimated at $5.7 billion annually. But of course they can't do it alone. You've heard some of the speakers just a bit ago. Now we know what the service of respite is. It's planned or emergency care that is provided to a child or adult with special needs in order to provide temporary relief to the family caregivers who are caring for those children or adults. We all know what the benefits of respite are, and we heard some of those testimonials earlier. It improves family caregiver stress levels, which can affect physical and emotional health. It improves overall family well-being and stability. It improves marriages, sibling and other family relationships, and it reduces hospital and other more costly out-of-home placements. "89% of family caregivers do not receive any respite at all. And of those who do, they receive too little and often too late." We know that for respite to be the most effective, it has to be delivered as early in the caregiving experience as possible. But many caregivers wait until there's a crisis in order to seek respite. We also know that the dosage is related to increased benefits. It should be received as frequently as possible in order to have a therapeutic effect. What the family caregiver does with their respite time also determines the benefits will be long-lasting. And we heard some of the speakers earlier today talking about having their hair done, or some activity that usually is an engaging in an activity that you're not thinking about the caregiving experience while you're doing that. Running errands or going to the doctor may not be a good use of your respite time. But it's better to engage in enjoyable activities and frequent social interactions. I see some heads shaking. And we also heard people say earlier about the rewards of respite to the care recipient. It must be meaningful to the care recipient as well as the caregiver, because if the care receiver is not enjoying the time or is uncomfortable with the time, then the caregiver is going to know that, and they're not going to be able to relax and enjoy their caregiving, their respite care. Now, we know that there are barriers to respite. We've heard a little bit about that earlier. First of all, there's confusing and restrictive eligibility criteria. And then one of the biggest issues is cost. Family caregivers may have given up a job to stay home and provide care. Again, we heard that story earlier. Or they may be faced with exorbitant medical or other costs related to the special needs of their loved one. So then respite just seems like a luxury that families can't afford. There are also a limited number of providers. There just aren't enough providers to go around. But even if families have resources to pay for respite, they may not be able to find providers who are well trained. And again, we heard our caregivers talking about that, especially for conditions that include emotional or behavioral disorders. Or providers aren't available at times that would be really most useful to families. For example, weekends, evenings, and overnight care. And then there's a reluctance on the part of the caregiver to identify themselves as a caregiver. They think of themselves as a spouse, a parent, a sibling, whatever, that they're just doing what they're supposed to be doing, and so they're reluctant to ask for help. And finally, there's the bureaucratic maze of funding streams. The Medicaid waivers, we heard a lot of talk about Medicaid waivers already today. They are by far the most significant funding stream for respite. But there are many other disparate and fragmented funding sources that can really confuse families, and they support a rather siloed system rather than a more accessible, coordinated system. Some of the other funding sources are the new healthcare reform and the new Veterans Administration provisions, the National Family Caregiver Support Program that we heard about earlier, block grants such as TANF, Maternal and Child Health, and Social Services block grants, etc. There are federal categorical funding streams such as the Child Abuse Prevention and Treatment Act, Family Support, and Alzheimer's Demonstration Grants. And then there are other state respite or family caregiver support programs. ARCH released a study of the myriad federal funding streams that fund respite or could potentially fund and support respite. You have a shortened version in your packet. I believe it is the pale pink sheet. Were you able to find the pale pink sheet? Excuse me. So what is lifespan respite? The definition in the law is it's coordinated systems of accessible community-based respite services for all family caregivers, regardless of age or special need. And we do stress the word systems. The concept really came from many of our state affiliates in the 90s, and we looked to those states because they successfully demonstrated the importance of building an infrastructure for respite service delivery and access. And those states were Oregon, Oklahoma, Nebraska, and Wisconsin. All of those 4 states are best practice states. And we call them best practice states because they were the models for the federal legislation. Some of the characteristics of the original lifespan respite programs are, these are some of the activities that they all did. Identify and coordinate existing respite resources at the state level, identify service gaps and create and monitor new respite services, to recruit and train respite providers, to connect families to respite services, providers, and payment resources, and to promote public awareness about respite. So I'm going to tell you a little bit about some of these original best practice states. Oklahoma's Respite Resource Network funnels 8 or 10 of its state or federal funding streams through a consumer-directed respite voucher program. Each stream is tied to the program's eligibility criteria, but the program figures that all out for the family so that the families don't have to worry about it. Oregon's Lifespan Respite Network has local programs in each of the 22 counties in the state where families could go for all of their respite needs. Nebraska uses a similar localized approach, but only has offices in the 6 regions of the state. The Lifespan Respite Subsidy Program helps families who don't qualify for existing funding streams. They've also done a really great job by collaborating across agencies to work together to recruit and train new providers, especially for the unserved and the underserved populations. And again, for more information on these programs, you can pull the, I believe it's the light blue sheet from your packet. And it describes the 4 states, best practice states. Now, from the outside, the lifespan respite system should look like a single point of entry with a no wrong door approach. The Lifespan Respite Program is responsible for all of the things in the boxes, for finding respite providers, linking to prevention services, for consumer direction, public awareness, quality assurance, training, crisis care. But all the family really needs to know is about the Lifespan Respite Program itself. But on the inside, this collaboration may mean co-location of staff or shared staff, or just working in harmony, in strong collaboration as organized partnerships to fulfill predetermined needs. The U.S. Administration for Community Living, Administration on Aging, administers competitive state grants for mandatory uses of the funds. And those mandatory uses are the development or enhancement of state and local lifespan respite systems, again the word systems, planned or emergency respite for all ages, training and recruitment of providers and volunteers. We didn't really hear a lot of talk about volunteers yet today. Provision of information to caregivers about respite services and assistance in gaining access to those services. Competitive grants were given to states beginning in 2009. So far, there have been 30 states plus the District of Columbia that have been funded. There were 12 states funded in 2009. Those are the red states. Nothing political about it, just those are the 2009 grantees. Another 12 were funded in 2010. Those are the gold states. And then there were 6 new states funded in 2011. Those are the blue states. And only 1 new grantee in 2012, and that was Iowa, the green state, kind of right in the middle. The initial 3-year grants were awarded to focus on infrastructure and system building and strengthening collaborative relationships. In fiscal years 2011 and 2012, some of the grantees received expansion grants to focus on service delivery. And then integration and sustainability grants were awarded to 7 of the original 12 grantees to continue and enhance their initial effort and develop sustainability plans. The red states with the stars are the ones that received those grants. Most families don't ask for help until there's a crisis in the family. There are so many family caregivers who never receive any respite at all. And then some crisis happens either with the health of the emotional or physical health of the family caregiver, and they're forced to reach out for help. But what we like to do is to encourage people to seek help as early in the caregiving experience as possible, and to have frequent and regular respite opportunities, not only just for the respite for the family caregiver, but also for the care recipient. It's really important that the care recipient enjoy that activity or be comfortable with that activity. Otherwise, the family caregiver wouldn't be able to relax and enjoy their time because they'd be concerned and worried about their loved one.
I honestly, probably a little too late. I realized that we needed help sometime, probably a year before he passed away. And we did seek that help mostly from family and friends. We did employ a caregiver to come in and give us a little respite, a little break from each other and from the exhaustion of caregiving. I feel like respite care is a win-win for everyone. It enables the caregiver to take a step back, have a little bit of normalcy, if you will, and it also gives the patient a little bit of a break. When you're with someone 24/7, that can be a little stressful at times, especially if you're going through some difficult things.
I realized, well, I've needed help for a long time because I took it all on myself for a very long time. And I realized about 5 years ago that we needed some special services. And even though I work in that field, and this was before ADRC was developed, I had a lot of difficulty finding the correct services, and he had to stay on a lot of waiting lists for a very long time. I think things are better now that there is an ADRC, that there are people that will not only give you lists of phone numbers, they will do the calling for you. They will help you weed through the mirage of things out there and let you know what is really truly helpful.
When T.D. made 64 years old, I had been doing it since she was 50, so I realized then that it was just too much, it was just too much. And by word of mouth, somebody said, go here, go there, which I did. And when I did go there, it was a turning point. It was a turning point. It was a relief, too, in a whole lot of ways.
We are trying to figure this out, that we're actually taking some steps to address those frustrations. I don't know that we're going to be able to resolve them today or tomorrow, but today we're taking the first steps at actually identifying what those barriers are and trying to figure out mechanisms for overcoming those barriers.
These federal grants are administered through the Administration on Community Living, Administration on Aging, and are available to states on a competitive basis. They're funded, the new grants are funded for a 3-year period of time to develop an infrastructure within the state and coordinate systems to provide respite care.
We need help. We need more persons interested. We need more caring people. We need money in order to maintain it. We need more programs that points toward the root of what respite is, okay? Basically, that's it. We just need the help. We need other persons to be in it like we're in it.
Respite care is very important. It's a critical facet of caregiving. It provides an emotional and physical break for the caregiver and for the patient. It provides a step back to just kind of take a deep breath and get back in there and be your best self, your best caregiver for the one that you love.
I hope that that this day is fruitful for the people here in Louisiana to come up with some good planning for the future and how to sustain this project beyond the federal funding level.
What I believe that is important for people to know about this is to understand that once they do have that grasp, that understanding of their need for respite, that there is somewhere that they can call to find out what their options are in providing that respite. A network that is available as to when they need the respite, they can get it. The Louisiana Lifespan Respite Coalition, it works in collaboration with the Department of Health and Hospitals and trying to build this network. So there is a website or a portal through the Department of Health and Hospitals, as well as a phone number that they can access for information.